Hi guys, welcome back to another one of our live Q&A sessions. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. We did take a 2-week break for the holidays, so I hope everyone had a wonderful holiday and a happy new year. As you can tell, I am not in my normal location. We are actually in South Beach, Miami, Florida for a filming on location. So that is why you are seeing me where you are. As I normally do, I'm going to go ahead and I'm going to get started and I'm going to answer some of the questions that you guys have submitted on the channel. If any of you guys have any questions, please feel free to put them into the chat. And we will answer them as we can. Unlike some of our other live Q&As, we normally try to link some of our videos into the description. Because of our location, we're not able to do that tonight, but I will let you know if I have a video on it so you can go ahead and go reference it. I'm going to go ahead and I'm going to get started with some of our questions that we received from the channel this week. And we had a lot of good ones. We're going to start with bleeding. Bleeding is one of the scariest things that can happen during pregnancy. And so I really try to make sure I get to the bleeding questions because even though it seems like it would be pretty much the same over and over, every situation is a little different and it can kind of give you an idea of what that looks like for a lot of people. So we're going to go ahead and get started. So the first one says, I'm 25 days late and I already took a test, which was positive. Apart from tender breasts and a heightened sense of smell, I've not started to have any other pregnancy symptoms. However, this afternoon, I started getting cramps and I could feel something coming out. My greatest fear has become a reality. I'm bleeding heavily and cramping in intervals. My doctor's appointment is on January 5th, and I'm 41, and this is my third pregnancy after 7 years. Am I losing the baby? Is it my fault? What should I do now? I have no access to a doctor. Please help me. And how soon can I conceive again if this is a miscarriage? The cramps are really painful, and the bleeding was heavy, and now it has clots. So unfortunately, this is an example of what's most likely a miscarriage. And so I wanted to start with this tonight because miscarriage is common, unfortunately. We're starting to realize that more and more women have experienced a miscarriage. It's somewhere like 1 in 6 or 1 in 5 now. And it's probably even more common than that because a lot of women will have a miscarriage and just assume the bleeding is their period, their normal menstrual cycle. Now, miscarriages can look a lot of different ways. And for some women, a miscarriage will have a lot of symptoms associated like cramps and pain and heavy bleeding and clots. When you are pregnant, you always want to seek medical care. One of the things that will happen is women sometimes won't seek medical care, assuming that they're having a miscarriage. And in fact, they aren't, and the bleeding is for some other reason. And there are certain interventions that we can do to help prevent the loss of a baby, especially if we're seeing issues with the cervix or issues with your uterus. And especially also if you have any kind of infection that might be causing the bleeding. Okay. Now, in addition to that, miscarriages, oftentimes women are sent home from the hospital to pass the baby and the birth parts like a preformed placenta, which are very tiny in the beginning, naturally. However, sometimes you can't pass everything naturally. And when that happens, you need something called a D&C. A D&C is dilation and curettage. This is basically where they manually open up your cervix and then they scrape the uterine lining to make sure all of the birth products have exited your body. If this isn't done, if the birth products aren't completely evacuated, you can continue to have pain. You can continue to have heavy bleeding, clots. You can get an infection. It can be really bad. It can also lead to infertility if you get an infection that's untreated. So if you suspect that you're having a miscarriage and you're having a lot of heavy bleeding and clots, you need to make sure you get assessed by a healthcare provider to make sure that everything is okay for you. Now, as far as conceiving after a miscarriage, it does depend. Everybody's different. It does depend on your health history and other factors. But usually most healthcare providers will actually tell you that you can start trying again as soon as you get your next menstrual cycle, which can be 4 to 6 weeks. I usually tell women personally, after being in women's health for so long, I think that it's really important for a woman's body to rest. And I think 6 to 8 weeks is really probably best for you, both mentally and physically. Okay. So I think that it's very important that you listen to your body and you just take care of yourself. All right, our next bleeding question actually came in on the sex video. And so it said, hello, I'm 16 weeks and 2 days. I used a vibrator 2 days ago. And after I felt burning when I pee, like a urinary tract infection, then the next day I had brown discharge. I have an appointment tomorrow, but can't sleep because I'm worried about the baby. So this is an excellent question, and I feel very passionate about talking about women's health and sex before, during, and after pregnancy. So, and hi, Amara, I see yours. I'll answer your question next. So when you are pregnant, hopefully you'll be able to have a very healthy sex life. And that includes for a lot of women the use of toys, including vibrators. Now, most women won't use dildos, which are sex toys that you usually insert, usually because the vaginal tissue thins out a little bit, gets a little bit drier. So sometimes they can be a little bit uncomfortable. A lot of women and kind of get a little nervous about inserting like a toy into the vagina, which it is safe as long as your doctor hasn't told you not to. But vibrators are still very commonly used. And actually, they can be very healthy for you because a lot of women, they don't actually have as much of a sex drive during pregnancy. I know we always hear about second trimester, women get all, very much in the mood, but that's actually not the case a lot of times. So for women that are not having that, a vibrator can really help you have a very active sex life. Now, the thing is, you have to clean it very well. Now, I know this seems kind of obvious, and a lot of us would say, oh, but of course I clean my sex toys. Well, the reality is we don't always clean our sex toys, and we don't always clean them well. So a lot of women might rinse or might do this. I know that may be gross to some of you guys, but I just keep it real. Now, when you are pregnant, because you're at a higher risk for infection, because you are considered immunocompromised, you have to be careful about everything, okay? Not crazy careful, but careful. So with the sex toy, if there was any kind of bacteria on it, it could have given you an increased risk of developing a urinary tract infection because the urethra is right next to the vagina and the clitoris. In fact, the urethra is in between the clitoris and the vagina. So a vibrator absolutely could be hitting that spot. Now, once you think you're having a urinary tract infection, you need to call the doctor and they'll get you on antibiotics, as this person indicated. However, she saw some brown discharge. So any type of infection, urinary tract infection, yeast infection, fungal infection, sexually transmitted disease caused by bacteria, all can cause uterine irritability, vaginal irritability, which can lead to spotting and bleeding. And brown is usually an indication of old blood. So if you see brown discharge, that's oftentimes old blood, which means we want to get it checked out. And in the case of a urinary tract infection, if we get you on antibiotics really quickly, we'll knock it out and you should be good to go. And then as far as any of you guys, please don't let this example scare you off from using a vibrator. If you're allowed to use a vibrator, use a vibrator. Just make sure you clean it. And don't go super crazy on your vibrators either. For example, you don't want to start using alcohol and all sorts of other stuff if it's not safe for your vibrator, because you could actually degrade the material and make it worse. So just follow the manufacturer's guidelines for cleaning. Okay. Now I see we have a question in the chat, so I'm going to go ahead and answer that. Hi, Amara. So how about incompetent cervix? I have a cerclage. I lost 2 times, 19 weeks and 21 weeks. Should I get strict bed rest? I'm 17 weeks now, already opened a little bit. Amara, I'm so sorry to hear this. This is a very difficult situation. So let me explain for those of you a little bit about what she's asking as I answer her question. So you have the uterus and then the cervix is below, okay? And the cervix is supposed to be long, thick, and closed. Now, just like my fingers, you see how there's this little opening? Obviously, the cervix can't be completely closed because it has to open to dilate. So this is where your mucus plug comes in. Now, when you have an incompetent cervix, what's going on is that it's starting to dilate, starting to open before its time. And then what we do sometimes is we offer a cerclage. And a cerclage is basically a stitch. It's basically just taking this and stitching it with a needle and surgical thread and to hopefully keep it closed. Now, the issue is as you start to open, if we have to gauge things properly because at some point in time we have to cut the stitch open or else we could cause damage to the cervix. So it's very important that we monitor a mom like this closely. So you're asking about should it be strict bed rest? So we have a video on bed rest that you can look at. And what I'm going to say about bed rest in general for everybody else but Amura. So bed rest comes with risks. It comes with a risk of blood clots and it comes with a risk of like potentially developing pneumonia. So when you're in bed and you're not moving around, your lungs won't expand as much as they need to, and it can cause you to develop pneumonia. And then when you're pregnant, you have a high risk of getting blood clots because you have higher clotting factors in your blood to help prevent a postpartum hemorrhage should you deliver. Now, for you, Amura, honestly, I'm thinking that an almost strict bed rest would probably be the best idea, especially if you are, 17 weeks pregnant. Where I am from in Florida, potentially at 21 weeks, we would bring you into the hospital to try to keep you pregnant for another week or two. And we often put women in Trendelenburg, which is where their head is almost down and their feet are up. Now, you cannot do Trendelenburg at home. That is not safe and it is not recommended. And you probably should be able to do very minimal stuff like use the bathroom. You would not want to be straining to go to the bathroom. So you should be asking your healthcare provider about whether you should be using stool softener or magnesium to help make sure that you have a regular bowel movement where you don't have to push. You want to be drinking tons and tons of fluid to prevent any contractions via any contractions via dehydration. You want to make sure that you don't have any infection. But yes, to be honest, at this point in time, any weight that's kind of pushing down on that cervix has a chance to help keep dilating it open. So I'd definitely be talking to your healthcare provider. They may not have recommended full strict bed rest if for some reason they felt like there was a higher risk for you to develop pneumonia or a blood clot, because of course those things could be an issue for you as well. So I would talk to your healthcare provider, but yeah, I do see that being a problem. And I'm so sorry. That's very, very stressful. I'm going to go ahead and answer the next question. Please feel free to ask any more questions that you guys might have. We had another bleeding question. After 7 years of marriage and many attempts of conceiving, my wife has spent the last 40 days straight bleeding, lightly but still very fine fibrous clots. Today, she's just taken a pregnancy test, as bold a positive as you've ever seen. Aside from the bleeding, there's been nausea and vomiting and nausea from the smell of cooked meat. Her breasts have been like war zones. A simple touch or change to cold going outside has brought on quite intense pain. I'm worried about the bleeding. 40 days is a long time. First pregnancy. Any advice and reassurance would be welcome. So one of the things that I want to let you guys know is that sometimes pregnancy is you're able to bleed and still having normal, healthy pregnancy. Okay. It's not that you should ignore the bleeding. You should definitely have it checked out. Most of the time we do an ultrasound to determine the cause, but oftentimes we will see bleeding. So bleeding can happen for a variety of reasons. One, it can happen due to implantation bleeding. So what happens is you have your uterus, and then attached to the side is the fallopian tube, and over here is the ovary where the egg gets released. And the egg, when it gets released, it comes down the fallopian tube and it meets the sperm, and it's in here that it gets fertilized. Okay, but then that has to come down and implant into the side of the uterus. And when that implantation happens, you can sometimes see some bleeding. Now, you can also get bleeding from sex. Again, the hormones that are there to have a healthy pregnancy will sometimes cause the vaginal tissue to be thinner, and therefore you can end up getting some bleeding from sex and stuff. Some women have a regular period that will come on. So even though they're pregnant, they'll still menstruate. And some women just bleed. I have a friend who bled for the first trimester every single day, heavy bleeding for 3 months, and still had 3 healthy children, full term, no issues. It's just how it was. So you want to go ahead and get assessed. You want to have them monitoring you. Usually if we're seeing bleeding every single day, but the pregnancy is going well, the hormonal levels are moving in the right direction, they may just have you see a maternal fetal medicine physician, who are the physicians that monitor high-risk pregnancies. And it would probably be considered a high-risk pregnancy for now. Okay. For those of you who are joining us, hi, I'm the maternity mentor. I am clearly on location. Please feel free to put your questions into the chat. So we had a couple questions on, we had a couple interesting questions on bleeding. One of them was about cervical polyps. So I'm having bleeding every other 3 days because of a cervical polyp. Will I miscarry? So cervical polyps, so you have your cervix, right? And then the cervix is like this. And a cervical polyp is like a little ball, like a grape or something that's kind of on it, that's hanging off. It's very loose tissue. And so what can happen is it can get very irritated, and that can cause some bleeding if there's any irritation of it. So can a cervical polyp cause a miscarriage? Unfortunately, it is possible. So cervical polyps can cause issues with fertility, but they can also make it difficult for women who end up with any other kind of disease, like a sexually transmitted disease or something like that, to stay pregnant. And that is what causes you to be at, like, it's easier for you to miscarry. So cervical polyps also can affect the cervix. So what happens is they basically can cause the cervix to be inflamed, cervicitis. And what happens with the cervicitis is, with this irritated cervix, the cervix doesn't know what to do, and it can start to open or dilate, which can make things worse. And that inflammation can lead to infection of the uterus, and infection of the uterus is very often a cause of miscarriage. That's why it's so important for us to treat any type of infection that you might have, because we want to make sure that you're doing well. And infection is one of the leading causes of miscarriage. Okay. So it's very important for us to be able to do that. So is it possible that a cervical polyp can cause a miscarriage? Yes, absolutely. So since we've done a couple questions that have kind of alluded to sexually transmitted diseases, I'm actually going to answer a couple of our sexually transmitted diseases that we got today. So we had a couple questions, first of all, on metronidazole, which is an antibiotic. So I'm going to go ahead and I'm going to answer. So I had a question that said, can BV, which is bacterial vaginosis, cause bleeding? I went to a walk-in clinic and they told me to take metronidazole. Of course, I looked into it, and since she's in the first trimester, it said it was unsafe. Why in the world did they give her this? So we made the decision not to take it. I heard it could be something in my sperm that causes her to get the BV. So I took a urine test and it came back negative, but I don't trust the test. Okay. And I did get another question that also asked about metronidazole. It said, hello, please advise me on my medication. I have the STI, which is sexually transmitted infection, trichomoniasis, and was prescribed metronidazole. I'm scared to take the antibiotics. Can you tell me what week in pregnancy I should wait, because I'm only 11 weeks and I cannot lose the baby? And the final question that I had about metronidazole was, I am 8 weeks in my pregnancy and was told to take over-the-counter Monistat 3 for a yeast infection. But I've been doing a lot of reading and I feel very nervous and anxious to take Monistat suppositories. I would just like to know if it's safe to take it in my first trimester. I'm 9 weeks pregnant and I've been tested with a yeast infection, bacterial vaginosis, and a urinary tract infection. I was prescribed turconazole 0.4% cream and metronidazole 500 milligrams. The manufacturer says it's not safe during my first trimester, but the nurse practitioner says it's okay. I am very worried. So, metronidazole, an antibiotic that we give for a variety of different sexually transmitted diseases. A lot of people, if you read online, will see that it says that it's not safe for use during the first trimester. So, let me give you a little bit more information. Metronidazole has to be given at proper doses. So if you are given too strong of a dose during the first trimester, it is not safe. It is absolutely not safe. So how could this happen? This could happen for a woman who was pregnant and did not know it and got a massive infection and was in the hospital for that infection and was given high doses of metronidazole. This can absolutely cause issues with the baby or lead to miscarriage. However, metronidazole is one of the most effective antibiotics for use for some of these sexually transmitted diseases in women. And what we've determined is that the proper dosing, which is much lower doses for shorter periods of time, it can be safe. So you want to make sure that you're balancing risk versus benefits. And unfortunately, bacterial vaginosis is extremely effectively treated with metronidazole. In fact, some of the other antibiotics aren't as good. Bacterial vaginosis, which is left untreated, can lead to miscarriage. Now, when it comes to sperm causing BV, sperm does not cause bacterial vaginosis. It is caused by an imbalance of normal bacteria in the vagina, and it's the bacteria that is found on the skin and genital areas of both men and women. Now, your sperm is alkaline. When you have sex and you are ejaculating inside a woman, your sperm is changing the pH balance of the vagina. And then if the bacterial vaginosis bacteria is present, that's what actually causes it to be more likely for a woman to get BV. So it's not really that your sperm is causing it, it's that your sperm is making it more likely for the infection to develop. So it's very important that both of you are clean when you're having sex, because that absolutely can, help you prevent getting bacterial vaginosis. Now, one of the other things is the question that had to do with yeast. So the yeast, urinary tract infection, and the metronidazole. So the turconazole specifically. So with yeast infections of the vagina, most of the yeast treatments that you find over the counter on the shelves of the pharmacy are safe for use. Okay, they are very safe. Now, that doesn't mean you should just go grab them, because as this viewer mentioned, she's like, oh, I don't know if I should use a suppository. It makes me kind of nervous. So it's one of those things that you do have to be careful, because your doctor may not want you to use a suppository. And like, if you are going to use a suppository, you need to make sure that your hands are very clean and that everything is very sanitary, et cetera, et cetera, et cetera, right? So it is important to make sure that you're following your healthcare provider's guidelines. So you want to definitely check that out. So this person was prescribed turconazole, which is a cream used for fungal infections, including yeast infections. Well, turconazole is actually not safe for use during the first trimester. So if you are prescribed turconazole, do not take it, and go back to your healthcare provider and have them explain to you why you are taking it. So turconazole is 100% absorbed by the vaginal tissue, and it will be absorbed into the baby. And what we do know is that we don't have safety data on turconazole, but a lot of antifungal medications can cause birth defects. So we have to be very careful with them. And considering we 100% know that this will be absorbed, we have to be careful. Additionally, in animal studies, while they did not show animals having a higher risk of miscarriage, they did show in rat studies delayed ossification of the bones. So ossification means like the hardening of your bones. So in babies, in baby rats that were in the belly still, the bones weren't forming right. So you just don't want to take the chance with turconazole unless this is definitely going to say prevent a miscarriage. So that's why you need to talk risk versus benefits with your healthcare provider. Okay. So that was an excellent question that we got, and I'm really glad that that one came up. And it highlights the importance of checking out your treatments and making sure, you really do understand what's going on. So we had, I'm moving right along. If you guys have any questions, please feel free to put them into the chat and I will answer them for you. We had a couple questions on drying up milk. So the first question is, I don't want to stop breastfeeding, but I want to reduce my milk supply for my baby who's 2 months old. I have a healthy milk supply and it seems to be problematic. Please tell me how I can get control over the milk. So for women who suffer from oversupply, it can be very challenging because you have this balance of, not wanting to dry up your milk completely, but also needing to like calm it down. So one of the things you can do is something called block feeding. And block feeding is where you only feed on one side and then the next feeding you feed on the other side, etc. While you're doing the block feeding, you can also use like a cabbage leaf on the breast, like maybe once a day, just to kind of calm down how much milk you're producing. But understand, for a lot of women, up until 2 months, you might have an oversupply. And then around the 6-week mark, all of a sudden things re-regulate. So you need to be careful. The other thing is that if you're going back to work, and a lot of women go back to work between 6 and 12 weeks, your milk supply may change at that time as well. So if your milk supply changes at that time, it will usually drop. And of course, then you will be wishing you had that oversupply back. So just make sure that you're being very careful with monitoring. But block feeding is a really great way to calm down the milk without tanking your milk supply too much. Again, feeding on one side and not feeding on the other, and then vice versa. Now, the other mom who asked a question said, I have stopped my breastfeeding now. My baby is 1.9 years. I've taken cabergoline tablets for 2 days, but it's now 7 days later and I'm still having a milk clot in one spot in my breast. When will it go away? What can I do to remove the milk clot? So, couple things. First of all, cabergoline. Cabergoline is also called bromocriptine. And bromocriptine is a medication that can be used to help dry up milk. I personally hate this medication. I don't recommend it. And I think it's very often not, the risks of this medication are not explained to women. So this medication is a medication that really helps dry up milk. It interferes with your prolactin production, which is what helps. The problem is this medication also makes you feel really good while you're on it. And then as soon as you stop it, you get this dramatic drop in your mood, and it can actually lead to postpartum depression, which is why I'm not a fan. Now, in this case, it sounds like a lot of her milk has come down, but she still has like a milk clot in there. So one of the things you can do for that is you need to pump on that side and do a lot of massage and warm compresses when you're pumping. I know pumping seems counterintuitive because you're trying to dry up the milk, but that's one of the things you have to do to evacuate a clot of milk in your breast. Okay. Now, the other thing you can do is you can take lecithin over the counter, and lecithin is like a vitamin. It's made out of sunflower seeds that will help thin out the milk, which sometimes can break up those clots. Okay. So you definitely want to do that. If you can't get that to if you can't get that to kind of clear itself out, you need to go see a breast specialist because they may have to aspirate the milk. That's where they take a needle and they put it in and then they pull out the milk that's like kind of clotted and congealed together, and that can help clear it up. Okay. But I would stop the cabergoline, first of all, because it's bad for your mood. And second of all, because it's most likely not going to help with that clogged duct at this point. Hi, Gabriella. So what are the steps to dry up your milk right after delivery? What is the first thing I need to do at the hospital, or the first thing I need to do when I get home? The first thing you need to do at the hospital is to tell everybody to not bully you into breastfeeding. So as many of you are aware, I am a lactation consultant, which means automatically I am pro breastfeeding. However, I am also very pro formula. Okay. I think that feeding is a choice and that moms should be allowed to feed their babies however they want to feed their babies. And there's a lot of pressure in the hospital, and that can lead to a lot of issues, pain, mood disorder, etc. So what are the things to do in the hospital? The first thing is to tell people right from the beginning. When you go into labor and delivery, they do a whole intake, they interview you, etc. And you say to them from the moment you're in there, I am not breastfeeding. I am not breastfeeding. I am not breastfeeding. Okay. And you tell them you've looked up everything and you are not breastfeeding. Now, here's another secret. A lot of times after you give birth, you may change your mind. If you change your mind, embrace it. If you want to latch your baby once and then never again, you can do that too. It does not have to be all or nothing, which is another common theme in the hospital. So just make sure you're advocating for yourself. Now, as far as drying up your milk, if you truly, truly know that you are not going to breastfeed, talk to your OBGYN and see if you're eligible to take Benadryl or Sudafed and see if they'll put it onto your hospital medication list so you can start taking it. Benadryl is brilliant because Benadryl can also help with anxiety and it can also help you sleep, but it's not so heavy of a sleep that you can't take care of the baby. So one of the nice things is Benadryl can dry up your milk pretty naturally, and then you can, it's very easy for you to take care of the baby and get some extra sleep. Another thing that you can do is actually peppermint oil deodorant. So you can go to like a local Whole Foods or something like that, and peppermint specifically can help dry up your milk. But I've had women who put peppermint oil deodorant, and that has really helped. Sucking on peppermints helps if it's real peppermint. And then, of course, you've got the cabbage leaves, the ice, the stuff like that. So definitely check out the videos that got linked into the description. But honestly, one of the biggest things right from the beginning is advocating for yourself. And, so that everybody knows what the deal is, and tell them, I'm not breastfeeding. So teach me how to feed my baby the proper way, which is paced bottle feeding. And so I have paced bottle feeding in the as one of my videos that we can link. And then, Gabriella, since you are on and you asked another question on the taboo subjects of pregnancy, which I thought was amazing. Do I go hair free from the vagina when I deliver? No one has told me anything about down there. So the answer is you can do whatever you want. And it never even occurred to me, for as many times as I've been in the labor room and stuff like that, that you would need, that this would have even been a thing. I guess I always thought that women did kind of whatever their preference is. So it is very hard for women to get down there and shave or wax or whatever at the end. So a lot of times we'll hear funny stories about how they ask their husband to do something, or a lot of women will go in and get a wax, sometimes for the first time right before they deliver because they're very nervous. Ultimately, you don't have to do anything. Now, if you were to need a C-section, your bikini line is very low. Okay, it's a lot lower than you might think. So what do? We have clippers. We have an electric razor with disposable blades. And if we need to prep you for a C-section, we'll just shave that very top part. And that's it. That's all we do. If you're having a vaginal birth, we're not going to do anything except let you deliver, let you be natural and stuff like that. There's nothing wrong. There's no reason to trim or not trim, to be clean or not clean. The only other thing I would tell you, though, that I have seen and I think is a big deal is if I was a woman who had never shaved or never had a wax before, I would not do that right before I delivered, because there's a lot of women who come in and the first time you wax or the first time you really shave, it's very tender. Like you'll get a lot of bumps. It'll be very red, very irritated. And so that absolutely can be very uncomfortable when you're trying to deliver as well. So that's the only thing I will say, but you don't actually have to do anything at all. Okay, so that was a very good question. Thank you, Gabriella. I had a question about HSV, herpes simplex virus. So, if you're herpes simplex virus positive and you're pregnant, will it affect the pregnancy? So, herpes simplex virus is something that, to be very honest, Most of us have. There's HSV1 and there's HSV2. And what happens is they both cause, one of them causes cold sores, one of them causes sores on the vagina or the penis. Most of us have both of these, okay? I know this is very taboo, but just so you guys understand, most of us have both viruses. And there's many women who show up to deliver and they're being told for the first time ever that they have herpes simplex virus because we see a sore on the vagina, okay? I think this is a subject that we should talk about a lot more because a lot of women feel very embarrassed by that and they shouldn't. It's just so common. But if you have an active herpes lesion on the vagina, you cannot deliver vaginally. It is an auto C-section. If we have a lesion we are not sure about, you're an auto C-section, okay? Because a baby has a much higher risk of developing a herpes infection if you have a vaginal birth with an active herpes lesion. Now, if you have active herpes infection and you go to deliver, your baby still could get a herpes infection from a C-section, which means your baby is going to go to the neonatal intensive care unit. In the neonatal intensive care unit, they're going to be monitoring your baby for up to 2 weeks to make sure the baby doesn't develop a life-threatening infection of the blood called sepsis. Herpes is a very, very deadly virus for babies. And unfortunately, I've actually known somebody personally who lost their baby to a herpes infection that was undiagnosed. So we take this very seriously. However, while you are pregnant, we don't have to worry about it too much. They may offer you some antivirals, like acyclovir, they may not. It just depends on your healthcare provider. But generally speaking, during pregnancy, we're fine. It's only if you have active infection and sores at the time of delivery. For those of you who are joining us, thank you so much. I'm Dr. Samantha, the maternity mentor. As some of you guys may have noticed, I'm on location right now in South Beach, Miami. So this is why I am filming from my car. Please feel free to put your questions into the chat. And otherwise, I'm going to keep going. I'm going to keep answering some of the questions that we've gotten on the videos over the last couple weeks. So, this is on my depression video. It says, I've taken bupropion, which is also called Wellbutrin, and trazodone, and I'm TTC. Is there any danger to my fertility? Thank you so much for this information. I started taking bupropion a few weeks ago, and I've been trying to conceive for 3 months. My cycle is currently on day 52, and I'm not sure I've ovulated. Does bupropion affect ovulation, menstruation, or fertility? Should I quit taking it? It's been less than a month of taking it. Please advise. Okay, so here's what I'm going to say about bupropion. Bupropion is a medication that we use for a variety of different things. We can use it for depression, motivation, energy, losing weight, quitting smoking, quitting drinking, mood stabilization, ADHD. It's a great drug. I love it. It's a fantastic drug in the psychiatry world. It is not safe for pregnancy, so I would stop taking it. And if you are taking, you need to talk to your healthcare provider because you should wean off of it. The reason why it's not safe is that it puts you at higher risk for seizures. So you cannot just stop taking Wellbutrin cold turkey. You have to talk to your healthcare provider and you have to taper unless you're on the lowest dose. Okay. Wellbutrin is actually okay for the baby, but it puts you, the mom, at higher risk for seizures. So it's really not the medication that you want to take right now while you're trying to get pregnant. Trazodone is just generally speaking considered safe, but I would actually ask to be taken off of trazodone. There's a different medication called Unisom. Unisom is actually over the counter. Unisom is one of 2 pieces of a medication called Diclegis. Diclegis is a medication we use for severe morning sickness, like hyperemesis gravidarum. But Diclegis is sometimes not covered by insurance. So what we end up doing is we sometimes tell women to get B6 and Unisom over the counter, and the 2 together make up this Diclegis. So Unisom on its own is something that people buy to help them sleep. It's a sleep aid. And so what I would tell you is if you can possibly sleep with Unisom instead, that's what I would actually be asking to use if you can. Trazodone is safe, but there's not a lot of data on it. So, if you can switch to something that's safe for first trimester, for sure, that would be what I would do. But yeah, I wouldn't take the bupropion. If you're looking for, I don't think it affects the menstrual cycle or anything. I don't think that's what's going on, but it is possible because it can affect your appetite and potentially you could lose weight on it. That could definitely add to things. If you're using it for like more of like a depression and anxiety, I would ask about maybe Zoloft. See if you're eligible for Zoloft. That's a really good medication, safe for pregnancy. I had a question on hemorrhoids. I'm 7 weeks pregnant. Can I use Anusol cream? So hemorrhoids, we talked about yeast infection treatments. There's a lot over the counter. Hemorrhoids, there's a lot of stuff over the counter. Anusol cream is one of those medications. So Anusol cream, there's not a lot of data either way. So it's considered probably safe, but you do want to ask your healthcare provider. You could ask your healthcare provider about Tux pads. Those are safe. Those are little cotton pads that have witch hazel infused into them. And I would absolutely recommend those because they can help shrink the tissue and they can also help to decrease pain. Now, one of the things that you guys want to know about all of this stuff over the counter, right? So we are now blessed in a lot of places in the world to have these pharmacies that you just walk in and there's all these meds. But just because you see meds there does not mean they're safe for use during pregnancy or even while you're breastfeeding. And the other thing is, a lot of people assume, like, for example, with the Turconisol question that we had, well, if it's a cream, right, then it's not necessarily going to get into the bloodstream. But that's actually not the case. Skin is our largest organ of the body. We start to absorb things through our skin. In fact, as nurses in the hospital, there are medications that are considered teratogenic. That means they can cause birth defects or miscarriage. And we get warnings to make sure we wear gloves so we don't touch these. This includes pills. If we're giving a pill that's teratogenic, we need to make sure we're wearing gloves if we're pregnant because it could cause a miscarriage. So understand that's how serious it is to absorb things through your skin. So you always want to check with your healthcare provider. But your second line of defense is your pharmacist. Pharmacists get specialized training in medications, and they're a secondary resource for you so that you can ask questions about safety of any medications. Okay. We always get a couple labor and delivery questions about am I getting close to delivery? One of them today said, I'm 39 weeks, I have dizziness, tiredness, headache, and I'm very hungry. Are these early signs of labor? Yes, 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 yes. Pretty much, I'm going to tell you guys anything that's not your norm is usually an early sign of labor, to be very honest. And you're at 39 weeks. If all of a sudden something's different, that's probably part of what's going on. Okay. The one thing I will tell you is 39 weeks with a headache that's not normal for you. You need to take your blood pressure. That can be a sign of an early sign of preeclampsia, which can be a life-threatening condition and can happen at this, like literally in the turn of a dime, drop of a dime, whatever that is. And so you want to make sure that you're taking your blood pressure if you get a headache. We had a couple questions on the RH factor video. So RH factor, it's rhesus factor. So we all have blood types, right? So you have A, B, AB, and O. And then you have positive or negative. So like O positive, AB negative, okay? That positive or negative is the rhesus factor. It came from some studies related to rhesus monkeys. Now, as a woman, if you are Rh negative and you get pregnant with an Rh positive baby, your body may attack that baby. And so the way we prevent that is by giving you a medication called Rogam. And Rogam is supposed to be given to you during your pregnancy and after you deliver if the baby is Rh positive. It's also supposed to be given to you after every single miscarriage or anything like that you might have. So the first question I got was, if a woman's blood is B positive and the man's blood is O negative, does the woman need to receive the Rogam shot after birth? And the answer is no. Any woman who is Rh positive does not need to receive the Rogam, period. Okay, period. But if she was A negative and he was O negative and the baby was O negative, she doesn't need to receive it either. Okay. So she only needs to receive it if she is negative and the baby is positive after birth. Now, the other question was, what happens if both parents are AB positive and both Rh positive parents have children? Okay. So you'd think that this means the baby's definitely going to have positive blood, and that is not the case. Okay. So this has to do with genes, and you can kind of think of like positive as a dominant gene and negative as a non-dominant, a recessive gene, okay? So what happens is there's this little diagram we learn in school, but basically if both parents are positive, right? That means they either both have dominant or they each have a dominant and a recessive. Now, when you go to put these two genetic profiles together, there's a 25% chance that neither one of them will give the dominant trait to their child. Therefore, the baby is born with two recessive traits, and therefore the baby will be negative. And that's how you get a negative baby from positive parents. And there's a 25% chance that that could happen. But it really, really, really does happen. Okay. So just so y'all know, that's a real thing. We had a question on the RSV vaccine. We just put out this video very recently because it's a new vaccine and I'm so excited about it. So it says, hello, if I get the RSV vaccine, how long will my baby have protection after the baby is born? And at what age can they get their own RSV vaccine? So your baby will have protection for approximately 5 months after birth. This is supposed to be given a couple weeks in advance because you need at least 2 weeks to build up antibodies in your system to then send them to the baby through the placenta, but the baby will get approximately 5 months of protection. Now, both women and babies are only eligible to receive the RSV vaccine when they are entering into the flu season. And so it just depends on your area. And flu season, RSV season. And one of the things you guys should know is that not every single geographic location has the same RSV season. For example, I am in Florida, which is part of the United States, and I'm on the East Coast of the United States. For most of the East Coast of the United States, RSV season mimics flu season. It does not in Florida. So we actually have a different time frame for our RSV season. So that's why it's really important that you know what your area's RSV season is. Okay. The next question that I had was about yeast infections of the breasts. I feel pain during feeding and after feeding. It's a burning sensation in my breast. I also felt like something is blocked in my left breast. Please guide me because it's been over a month now. Okay, when you have a deep burning sensation in the breast, that's usually a yeast infection of the breast, which makes sense why this question came in on that video. So if you have that deep pain and stuff, you need to get evaluated by a breast specialist. I usually recommend women who are having any long-term breast issues go to a breast cancer specialist. Now, that sounds scary, but just understand, if you think about it, who is the absolute number one expert in breasts? It is a breast cancer specialist, and they know what to look for in ultrasounds. They know what looks normal, what doesn't. They know how to biopsy stuff. They know all of that. They know the best medications for the breasts. So understand, when a woman is breastfeeding or post-breastfeeding and she's having issues with her breasts, go to a breast cancer specialist. Do not fool around with OBGYNs who don't do this every single day for a living, okay? Now, what do you use for a breast infection? Believe it or not, it's usually diflucan. Diflucan is a pill. It's an oral pill that we give to women for vaginal yeast infections. Now, when diflucan is given for a vaginal yeast infection, it's usually given for 1 to 3 days. For a breast yeast infection, that is not enough. That will not take care of it. You will need a 2-week treatment, okay? So that's why it's also important to get with somebody who understands how to treat these infections. So you need 2 weeks treatment. Additionally, if you are still actively breastfeeding, you need to go ahead and get the baby treated. And this is where it gets even more difficult because a lot of pediatricians do not want to treat the baby just because you're being treated for yeast. But if you don't treat the baby, you guys are just going to pass it back and forth to each other. So you need to make sure everybody's on board and you'll get the right treatment so you can get rid of it. We are finishing up. I do have a couple more questions, but if any of you guys have any questions, please feel free to put them into the chat. I have a question on second trimester bleeding. I'm 16 weeks pregnant with twins, and last night I saw red blood on my panties covering 3 to 4 inches almost. I rushed to the emergency room. They did an ultrasound. The babies were fine. The cervix is closed and long. But I continued to bleed every time I used the restroom. I saw blood with urine on the toilet paper while wiping. That was quite a lot. But apparently things are fine. How would I know the reason? There's no cramping, only a slight backache. They gave me an injection of Dufastan. What should I expect? Okay, so Dufastan is an injection of injection of progestin, which is really not been shown to be effective anymore. A lot of people use it for preterm labor, but a lot of the studies are now showing that it's no better than a placebo injection. It's supposed to help with the hormones to help keep you pregnant. Why are you bleeding? It could be any number of things. One of the things it could be is a subchorionic hemorrhage. So a subchorionic hemorrhage is, so you have your uterus, right? And you have the placenta that attaches to the uterine wall. And sometimes underneath you'll get a little pool of blood, and that pool of blood will sometimes leak out, and that's a subchorionic hemorrhage. We oftentimes will see them on ultrasound, but if the hemorrhage basically evacuated itself and there's nothing left, by the time you got to the emergency room, they may not have been able to see it. Now, unfortunately, also with twins, it depends on the positions of the placentas. Is there one placenta? Is there two placentas? And a variety of different things. You could have had a little bit of cervical pressure or cervical inflammation, which could have caused some of that bleeding. What needs to happen right now is you need to follow up with your maternal fetal medicine physician. So again, maternal fetal medicine physicians are the ones who handle high-risk pregnancies. And maternal fetal medicine specialists should be taking care of a woman with twins. So this is the point where you need to go in and get a specialized ultrasound and see how is the blood flow to both of the babies? How are the placentas looking? What are the placenta positions? Make sure that everything looks good. And here's why I mentioned placental positions, okay? So we got a question on our Placenta Previa video, and it says, I'm 36 weeks and 2 days pregnant. The 33-week scan mentioned posterior and low-lying lower margin touching the os placenta. Is a normal delivery possible? Okay, so let's explain. Uterus, okay? Cervix. Front towards you guys, that's anterior. Posterior is back towards me, okay? So when you have a posterior placenta, it means it's towards the back, towards your back, okay? Now, the placenta normally attaches on the side of the wall, okay? Because here's your cervix. Now, sometimes the placenta will be low-lying. That means it's like right here. And in her question, she said it was, I want to make sure, lower margin touching the os. So the opening of the cervix is the os. This is the cervical os. So her placenta was touching like right here, okay? Partial previa is like that. Full previa is like this. Full previa covers. If you have a full or a partial that is not resolved, it is an auto C-section, because when the cervix opens, if you have part of your placenta here, this is all blood vessels. As soon as this opens, you just start bleeding out. So the baby is hemorrhaging and you're hemorrhaging, and it's a life-threatening emergency for both of you. Now, low-lying is right next to it. And oftentimes what happens is as your belly gets bigger, the placenta migrates. That means it moves. So as the belly is expanding, the placenta expands with it, and it moves away from the cervix because the cervix is static. It doesn't move, okay? It maintains its position. So is a normal delivery possible? Absolutely. Because to be very honest, if they were worried about you having a normal delivery, you would already know it, because they would be ultrasounding you every 5 seconds. Because when you have a complete previa, it's an automatic C-section. We usually C-section you at 34 weeks. And we do that because we cannot take the chance that you dilate at all. The second you dilate, it's a medical emergency. So very often for a complete placenta previa, we're giving a C-section between 34 and 37 weeks. And usually you're hospitalized that entire time. So for somebody like you who hasn't heard anything and you're at 39 weeks, I'm telling you, you probably are going to be able to have a normal delivery with no problem. But you want to ask your healthcare provider, okay? You want to ask them and see what they're saying. Okay. But that's a good question. And that's kind of, why it's important to know what's going on. And with our twin pregnancy, same thing. What are the babies looking like? What are their placentas looking like? All right. We've got our last couple questions here. So we have a question about postpartum hemorrhage. I'm 10 weeks postpartum and I'm still bleeding. And the bleeding only occurs when the baby breastfeeds a lot. The bleeding sometimes contains clot and usually the bleeding is light. Please let me know if intermittent bleeding is normal or if this is a postpartum hemorrhage. Okay, so intermittent light bleeding is not a postpartum hemorrhage. A postpartum hemorrhage is heavy, heavy bleeding that continues to go over and over, longer and longer. So this is not a postpartum hemorrhage, okay? However, it could be that you've gotten your normal period, or it could be that maybe you've got something else going on. So what you do want to do is you want to contact your healthcare provider so that you can do a uterine ultrasound to find out if anything else is going on. But you definitely want to make sure that you get that checked out. But this is not a postpartum hemorrhage. Now, the reason why it's happening more when you breastfeed is the milk ejection reflex hormone, which is oxytocin, is also the hormone that causes you to have uterine contractions. When you're breastfeeding, the uterine contractions are part of what helps you heal and stop bleeding after birth. So it makes sense to me that you're bleeding more when you breastfeed, but still you shouldn't be bleeding for this long after this time. The next question I got was how can having too many babies put you at risk? So our bodies are not intended to be pregnant over and over and over again, okay? And our bodies need time to recover. And really, the time is approximately 2 years between pregnancies, okay? And so this is from the time that you're give birth, you shouldn't start to try to get pregnant until that baby is 2. Okay, because your uterus needs time to heal. And every time that you get pregnant, the uterine wall stretches and stretches and it can become really thin. I've been in C-sections where when we go in to take the baby out, the uterus is so thin it looks like paper or like a almost like a window that hasn't been washed well. I mean, it's that thin. And once you're at that point, you're at risk for having postpartum hemorrhage or other issues. So it's very important that you space out, giving your body a chance to heal. And the other thing is that our bodies were never meant to have baby after baby after baby. And so really, if you can help it, you don't want to have too many babies. Now, ultimately, your healthcare provider knows your health history the best. And so therefore they can answer that question to the best of your ability. But really, you need to space babies out by at least two years. Okay. And now I'm going to do our final question. I saved this for the end because usually by the end I get the most people here. And I think this is one of the most important questions that I get and I feel really passionate about. So this came from a woman and I could see her profile picture on YouTube. So she's an African American woman. I went to the hospital because I've been in pain my entire pregnancy. I started bleeding. Blood was coming down my leg pretty crazy, like I was on my cycle. I'm currently 13 weeks pregnant. They took my blood and pee and then told me after 2 hours of me waiting to be seen that it's nothing they could do for an early pregnancy miscarriage and just to go home. And my response was, honestly, I would go back to the hospital or a different hospital. If I were you, I would remind them that pregnant Black women get the worst care in this country over any other demographic. Studies have proven this. Then respectfully ask them to run every test they can to determine the cause and possible treatment. I wish I didn't have to write this part, but systemic racism is real and Black women have to advocate hard for themselves in their health care. So I wanted to highlight this, and this actually applies to any woman who's not, unfortunately, Caucasian. In the United States and in other parts of the world, we are absolutely determining that women of other races are not getting the best care. And this is something that should be actively addressed, and a lot of healthcare systems are trying to. But in this case, this highlights the thing that I can tell you there's many, many tests that can be done. She doesn't mention an ultrasound. It's possible she got an ultrasound, but I would imagine she would have mentioned it. it is important to make sure you're advocating for yourself. You are allowed, as long as you are being respectful, to say, I am concerned I am not giving the level of care that I need due to my race. What are they going to say to you? You are? Start Googling what people would do. But generally speaking, if you come into a hospital and you are going to be, and you are actively bleeding at 13 weeks pregnant, you should be having a urine test. You should be having a blood test. You should be having an ultrasound. Those are the three things. They should be swabbing you to see if you have any kind of infections. Okay, so they should be looking in your vagina and taking a swab to see if you have a sexually transmitted disease or a yeast infection or a fungal infection, because you cannot tell if you have, for example, chlamydia, which can cause a miscarriage. You cannot tell if you have chlamydia necessarily from the blood. You cannot tell if you have a yeast infection from the blood for sure. That you cannot tell. So they need to be checking all possible sources of infection and causes of bleeding to make sure you get the right health care. Okay. And so if you are of another race, please make sure you're advocating for yourself. Don't be afraid. As long as you are being respectful, there's nothing wrong with you asking them to do everything. Okay. And no one should just assume you're having an early miscarriage. Anybody who watches my videos for this amount of time knows there's many reasons why a woman can bleed. That does not automatically mean she is having a miscarriage. And therefore, we need to look for other causes to determine that she is safe and to have every chance to save that pregnancy. I am Dr. Samantha. I am the maternity mentor. Thank you for joining me on another Monday night at 9 p.m. Eastern Standard Time. We are on location tonight, but I'm so glad you were able to join us for this live Q&A. We are over on Facebook, Instagram, and Twitter. You can follow us there for additional content. Please like and subscribe to the channel. We really appreciate it. Hit the notification bell. Share this channel with your friends, your family, your coworkers, your grandparents. Share it with everybody. Somebody always knows somebody who's having a baby or just had a baby. I really appreciate all of your support. We definitely have new videos coming out. I am hoping that I am going to be doing our next video on Cervidil in time for Gabby to see it. But if not, I will try to message you guys. Jennifer, hi. I haven't seen you in a while. I am doing this because I am on location filming live in South Beach, Miami, which is why right now, to avoid the music and the crowds, and it's a wind advisory right now, we are in a car doing a live because I did not want to cancel a third week on you guys. So here I am. I am really glad to see all of you guys. Thank you so much. Bye for now. I'm the maternity mentor. Thank you.